Most of the organizations that would like physicians and nurses to come over want you for months to years, a commitment of when you've retired to really be there long term, because they'll take a lot of time to train you and be involved with the organization. I wanted a chance to give people who are in my stage of life, we have families and we have lots of other obligations, but we can take a week out and have a chance to go abroad and help out. And I found that there's a lot we can do, and there are organizations that want to support us in doing that. The first mission that I took was to Katrina, and we were there when St. Bernard Parish reopened. I was shocked to see a place in the United States that looked like a nuclear bomb had landed. Basically, we rolled into St. Bernard Parish, and the mud was all cracked over, not just the ground like you see on a desert, but over the buildings as well, because the water had completely submerged most of the buildings, some of them at least up to the roofs. It was just eerie because there were no animals, no pets, no wildlife, no insects even around. So it was just strangely like a dust town. And we sat down in the Walmart parking lot where FEMA and the other insurance agencies were providing aid to the returning survivors, and they were coming back to try and find things from the homes and then talk to the insurance companies. We were there and we were helping out, where we were wondering where were the federal agencies that should be providing health care. They have DMAT, federal disaster teams and things like that, and they had set up in large places at a distant site in a high school field because they had enough space. We were small and mobile, teams of 10 to 12 physicians and nurses, and we sat down where the people were. I think the thing that I've learned is that many people in areas outside of the disaster area are in shock and in awe of the devastation and of the problems that the people affected, the evacuees, are enduring. And they don't really know how they can help. And so they kind of see the entreaties of large organizations that are well equipped to provide really enormous amounts of aid to these big disasters. And in many disasters, they're very helpful. Sometimes what I've found, and what I've found repeatedly, is that they're less effective in distributing the aid that they collect than small organizations, local churches, local people who are just banded together to help people in the disaster.